Welcome back to MDH Minute. I'm Patrick Osterman, joined today by Julie Bartlow from the MDH Pediatric Clinic. Julie, thanks for joining us.
Yes.
Julie, let's talk COVID vaccines. You've been offering the vaccines now for a couple months. From the research that you've done prior to giving the vaccines to what you've seen the first couple months, can you share with our audience some of the pointers, some of the tips and bits of advice that you've picked up along the way?
Vaccines in kids really seem to be well tolerated. What we found, especially even more so in this 5 to 11 age group, is they're having minimal side effects with it. Arm soreness really seems to be the biggest effect, but kids are tolerating it fairly well. You know, it's been exciting to watch the number of kids who are excited to come in and get their vaccine and contribute and do their part to helping, protect their family members and other people around them. And so we've really had good success with it. I think statistics right now are showing somewhere around 25% of kids between 5 and 11 have gotten at least their first dose, and somewhere around 65 or so percent of the 12 to 17-year-olds have at least one dose. And so we're really looking forward to getting those numbers up and getting that group of kids even more protected.
Now, some of the side effects you were just talking about, namely the sore arm, that's really no different than some of the normal routine vaccines that they would typically get, let's say after 2 months, 2 years, entering kindergarten and such.
Absolutely. With any of those vaccines, one thing I always make sure my parents know is local irritation, inflammation, redness around the injection sites, fever, fatigue, all of those can be part of any reaction to any vaccine. But really, like I said, this vaccine is well tolerated and kids are doing great with it.
So when families have come in, they want to get their child vaccinated, have you had that conversation quite a bit with the parents or with the caregivers, and you've actually ended up giving the vaccine to most or all the entire family members at that time?
We had a kid have come in yesterday even who came in to get the vaccine for the sister, and he had recently turned 5, and so we sat down and had that conversation. I think everyone is a little bit hesitant. This is a newer vaccine and we're still learning a lot about it, but we've got a lot of information on this vaccine from the number of people who have been given it over a year. Over this past year, and really it's shown to be a safe vaccine, and it is effective. It's effective at preventing significant illness and hospitalizations and death across every age group, and that's no different in kids than it is in adults.
Well, and it has gotten the stamp of approval from the American Academy of Pediatrics, correct?
Yes. And so, I know there's a lot of information out there as you look through different social media platforms, you hear things from your friends, from your neighbors. It's really, really important to make sure that you're looking at good information. The American Academy of Pediatrics, it is their job to look through the scientific data and make sure that the recommendations that they are making is in the best interest of all kids. And so if the American Academy of Pediatrics recommends it, I have no problem recommending it to my patients. Both of my children have had it, and I truly believe it's the way that we help get our kids back to a more normal life where they can participate in their activities and stay in school and feel safe in doing so. And it's not too late to get that vaccine started. We know, even with one dose, that if you were to get COVID after that, it's going to help keep your infection from being as significant. And so, schedule your appointments as soon as you can. We have it available here. Dr. Lockard has it available in her office. The health department is offering clinics, and we can give that to those 5 to 17, 18-year-olds here and get your own appointment scheduled if you haven't done so already.
Well, Julie Bartlow, thanks for taking time out today.
Yep.
For Julie Bartlow, I'm Patrick Osterman. Thanks for watching MDH Minute.